Today, we're going to talk about fatty liver, a health problem that's becoming more and more common. This condition, also called hepatic steatosis, is when too much fat builds up in your liver. It might sound strange, but your liver isn't supposed to store a lot of fat. When this happens, it can lead to serious health issues. Let's start with some surprising facts. Back in the 1990s, fatty liver was pretty rare. But now, it's so common that even children are getting it. In the United States, more than 30% of adults over 35 have fatty liver. That's almost 1 in every 3 people. You might think, a little extra fat isn't a big deal, right? But the truth is, if you don't treat a fatty liver, it can cause serious health problems. Your liver might get scarred, which is called cirrhosis. In some cases, it can even lead to liver cancer. In fact, fatty liver has become one of the main reasons why people need liver transplants worldwide. That's why we can't ignore this problem. The good news is that if we catch fatty liver early, we can often fix it. Your liver is amazing at healing itself, but only up to a point. That's why it's so important to know the signs and symptoms of fatty liver. If you spot them early, you can take steps to prevent the disease from getting worse. You might even be able to reverse it completely, leaving your liver healthy and clean. In this talk, we're not just going to cover the signs and symptoms. We'll also discuss a type of food that's one of the main causes of fatty liver. If you know or think you might have fatty liver, you'll need to avoid this food completely. And don't worry, we'll also talk about natural ways to get rid of fatty liver by changing some of your habits. You might be surprised to learn that some of the best remedies for fatty liver could be right in your kitchen, not at the pharmacy. So, let's dive in. We're going to look at 17 symptoms of fatty liver that you shouldn't ignore. We'll start with 6 early symptoms, and then we'll talk about 11 more serious signs that mean your liver might be in trouble. But before we get to the symptoms, there's something really important you need to know. Fatty liver is often called a silent disease. This means that many people have it without realizing it. In fact, more than a third of adults have fatty liver without knowing it. Often, people find out they have it by accident, like when they get an ultrasound or blood test for something else. The doctor might notice that their liver enzymes, things called AST and ALT, are higher than they should be. Finding out you have fatty liver can be a big surprise, especially because in its early stages, it doesn't usually cause symptoms like other diseases such as diabetes, high cholesterol, or high blood pressure. But if you do find out you have fatty liver, don't panic. In the early stages, it's often possible to completely reverse the condition. Your liver has an amazing ability to heal itself if you give it the chance. If you finish this video, you will learn the following. 6 early symptoms of fatty liver disease. 11 late-stage symptoms of fatty liver disease. 5 factors about who's more likely to get fatty liver. 4 important steps if you have fatty liver or want to prevent it. 5 foods that are bad for your liver, if you have fatty liver. 6 foods that can help clean out your fatty liver. Now, let's look at those 6 early symptoms of fatty liver. 1. Feeling very tired. Your liver does a lot of important jobs in your body. It helps break down the food you eat and turns it into energy. But when there's too much fat in your liver, it can't do these jobs as well. This can make you feel tired constantly. If your liver is also inflamed, which doctors call steatohepatitis, you might feel even more tired. A liver that's not working well can also mess up your hormones, which can affect your mood, how well you sleep, and how much energy you have. 2. Stomach pain and heartburn. A study from a university in Brazil found that people with fatty liver often have problems with their digestion. They might feel a burning sensation that goes from their chest to their throat, that's heartburn, burp a lot, or feel like their stomach is always full. These problems happen more often in people with fatty liver than in people without it. 3. Too much gas. If you have fatty liver, you might notice that you have a lot of gas. This extra gas can even make it hard for doctors to see your pancreas clearly when they do certain tests. The gas probably happens because fatty liver can change the balance of good and bad bacteria in your intestines. 4. Pain on the right side of your belly. You might feel a dull ache or a feeling of heaviness on the right side of your upper belly, just under your ribs. This is where your liver is. Sometimes, this pain might even spread to your right shoulder. This happens because when your liver has too much fat in it, it can get bigger, which can press on nerves and cause pain. 5. Not feeling hungry. Fatty liver can make you lose your appetite. This can happen for a few reasons. Your liver might not be processing nutrients properly, or the extra fat might be causing inflammation. You might also feel nauseous or uncomfortable in your belly, which can make you not want to eat. Sometimes, worrying about your health can also affect your appetite. 6. Feeling sick to your stomach. Nausea is common in people with fatty liver. This happens because your liver isn't working as well as it should. It might not be filtering toxins out of your blood properly, which can make you feel sick. The inflammation in your liver can also cause discomfort or pain in your belly, which can make you feel nauseous. Plus, if your liver is bigger than it should be, it might press on your stomach, making you feel full and sick. These 6 symptoms usually suggest that you might have fatty liver in its early stages. But there are also more serious symptoms that can show up if fatty liver gets worse. Let's look at those 11 late-stage symptoms that you really shouldn't ignore. 1. Itchy skin all over. If your liver disease has gotten to an advanced stage, you might start to feel itchy all over your body. This happens because your liver isn't processing bile properly, so bile salts build up in your blood. These salts can get into your skin and make you itch. The itching often starts on your palms, but it can spread all over your body. 2. Yellow skin and eyes. This condition is called jaundice. It happens when a yellow substance called bilirubin builds up in your body. Normally, your liver processes bilirubin. But when your liver isn't working well, the bilirubin can build up and make your skin and the whites of your eyes look yellow. 3. Pale poop. Your poop gets its normal brown color from bile salts that your liver produces. If your liver isn't working well, it might not make enough of these bile salts. This can make your poop look pale or clay-colored. 4. Dark pee. When your liver is having problems, it might release more bilirubin into your bloodstream. Your kidneys filter this out and it ends up in your pee, making it look darker. It might look the color of cola or tea. 5. Red spots on your skin. Your liver makes proteins that help your blood to clot. If it's not making enough of these proteins, you might notice little red spots on your skin. These are tiny bleeds under your skin that happen because your blood isn't clotting properly. 6. Spider veins. These are small, spider web-like veins that you can see through your skin. They often show up when your body has too much of a hormone called estrogen. This can happen when your liver isn't processing hormones properly. 7. Men might notice enlarged breasts. This condition is called gynecomastia. It can happen when liver problems cause a hormone imbalance in your body. Specifically, men might have too much estrogen, which is usually thought of as a female hormone, compared to testosterone. 8. Red palms. This is called palmar erythema. It happens when tiny blood vessels in your palms dilate, get bigger. Like many of these symptoms, it's often related to hormone imbalances caused by liver problems. 9. Trouble seeing at night. Your liver helps store and process vitamin A, which is important for your eyesight. If your liver isn't working well, you might not have enough vitamin A, which can make it hard to see in low light. 10. White fingernails. If most of your fingernail looks white, with just a thin pink or brown band at the tip, this could be a sign of liver problems. It happens because liver disease can affect how nutrients are distributed in your body. 11. Swollen legs and ankles. This swelling, also called edema, can happen when your liver isn't making enough of a protein called albumin. This protein helps keep fluid in your blood vessels. Without enough of it, fluid can leak into your tissues, causing swelling. These symptoms are serious, and if you notice, pay attention to them. But what if you don't have any symptoms? How can you find out if you have fatty liver? Doctors usually diagnose fatty liver using imaging tests like ultrasound, CT scans, or MRI. These tests can show if there's too much fat in your liver. It's normal to have a little bit of fat in your liver, but if more than 5% of your liver is fat, that's when doctors start to worry. Now that we've covered the early and late stage symptoms of fatty liver disease, let's explore some additional aspects that can help you better understand and manage this condition. It's important to know that there are actually two main types of fatty liver disease. Alcoholic fatty liver disease, AFLD, happens because of heavy drinking. When you drink too much alcohol, your liver has to work overtime to process it. This can lead to fat buildup in your liver cells. Non-alcoholic fatty liver disease, NAFLD, this type isn't related to alcohol use. It's often linked to obesity, diabetes, and other metabolic issues. NAFLD is becoming increasingly common, even in people who don't drink alcohol. Both types can progress to more serious liver conditions if not addressed. NAFLD can progress through several stages. Stage 1. Simple fatty liver, steatosis. This is the earliest stage, where fat builds up in the liver, but doesn't cause inflammation or liver damage. Stage 2. Non-alcoholic steatohepatitis, NASH. In this stage, the fat buildup is accompanied by inflammation and liver cell damage. Stage 3. Fibrosis. As the liver tries to repair itself, it forms scar tissue. This scarring can be mild to severe. Stage 4. Cirrhosis. This is the most severe stage, where extensive scarring has occurred. At this point, the liver may struggle to function properly. Understanding these stages can help you appreciate why early detection and treatment are so important. The role of insulin resistance. Insulin resistance plays a significant role in the development of non-alcoholic fatty liver disease. When your body becomes resistant to insulin, it can't use glucose, sugar, effectively for energy. Instead, the body starts to store this excess energy as fat, including in the liver. This is why people with type 2 diabetes or prediabetes are at higher risk for fatty liver disease. Managing your blood sugar levels through diet, exercise, and medication, if prescribed by your doctor, can help improve both your diabetes and your liver health. The impact of stress on your liver. Chronic stress can also play a role in the development and progression of fatty liver disease. When you're under stress, your body produces cortisol and other hormones. Over time, elevated cortisol levels can contribute to insulin resistance and fat accumulation in the liver. Moreover, stress can lead to unhealthy behaviors like overeating, especially high-fat and high-sugar foods, or increased alcohol consumption. These behaviors can directly contribute to fatty liver disease. To manage stress, consider practices like meditation, deep breathing exercises, yoga, or regular physical activity. Even simple activities like taking a walk in nature or spending time with loved ones can help reduce stress levels. Now, let's talk about who's more likely to get fatty liver. There are several risk factors. Being overweight, extra body fat, especially around your belly, can lead to fat building up in your liver too. Having type 2 diabetes, this condition makes it harder for your body to use insulin properly, which can lead to fat accumulating in your liver. High blood pressure, this often goes hand in hand with other risk factors like being overweight and having diabetes. Drinking too much alcohol, your liver processes alcohol, and too much can lead to fat buildup and damage. Not getting enough exercise, a lack of physical activity can contribute to weight gain and other factors that increase your risk of fatty liver. Some medications can also increase your risk of fatty liver. These include amiodarone, a heart medication, diltiazem, for high blood pressure, tamoxifen, used in breast cancer treatment, and corticosteroids, used for various conditions. So, what can you do if you have fatty liver or want to prevent it? Here are 4 important steps. Avoid alcohol. Alcohol can damage your liver cells and lead to more fat buildup. If you have a fatty liver, it's best to avoid alcohol altogether. Exercise more. Aim for at least 150 minutes of moderate exercise each week. This could be as simple as going for a 30-minute walk, 5 days a week. Lose weight. Even losing just 5% of your body weight can make a big difference. It can reduce inflammation in your liver and help get rid of some of the fat. Eat a healthy diet. What you eat plays a big role in your liver health. Often, an unhealthy diet is the reason for fat buildup in the liver. But the good news is that a healthy diet can help reverse this. Speaking of diet, let's talk about 5 foods that are particularly bad for your liver. If you have fatty liver, you should try to avoid these. Foods with added fructose. This doesn't mean fresh fruits. The big problem is corn syrup and added fructose, which you'll find in sodas, cereal bars, rocks juices, and many sauces. Sugar. Too much sugar can lead to fat buildup in your liver. This includes regular table sugar and other forms of added sugar. Ultra-processed foods. These are foods that come in packages and most fast foods. They're often high in unhealthy fats, sugars, and additives that can harm your liver. Refined wheat. This includes white bread, pasta, and crackers. These foods can quickly raise your blood sugar levels, which isn't good for your liver. Some vegetable oils. Many vegetable oils are high in omega-6 fats. While we need some omega-6, too much can cause inflammation in your body, including your liver. Now for the good news. Here are 6 foods that can help clean out your fatty liver. Fruits, especially avocados. They're high in a substance called glutathione, which is great for your liver. Whole grains, things like oat bran, flax seeds, and chia seeds are high in fiber and omega-3 fats, which are good for your liver. Cruciferous vegetables. This includes broccoli, Brussels sprouts, and cauliflower. They contain substances that can help reduce inflammation in your liver. Olive oil. Try to have 3 to 4 tablespoons of olive oil each day. It can help reduce fat in your liver. Turmeric. This spice has anti-inflammatory properties. Try to have it with a bit of black pepper, which helps your body absorb it better. Coffee. Coffee contains several substances that are good for your liver. It can help reduce inflammation and protect against liver fibrosis, scarring. Remember, your liver can heal. One of the most amazing things about the liver is its ability to regenerate and heal itself. If you've been diagnosed with fatty liver disease, don't lose hope. By making healthy lifestyle changes, you can give your liver the chance to recover. Thank you for taking the time to learn about fatty liver. Knowing about our health gives us power. By understanding this condition better, you're taking an important step towards protecting your liver and your overall well-being. If you find this video helpful, don't forget to share, like, and subscribe.